Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. When you face surgery, one thing you'll want to know about is anesthesia. Here with me to talk about the options is Dr. Susan Samudre. She's an assistant professor of anesthesiology and director of regional anesthesia at Upstate. Welcome to the Informed Patient, Dr. Samudre.
Thanks so much for having me.
Let's start with the purpose of anesthesia in the first place. Why do we need anesthesia?
Anesthesia seems like this big mysterious thing, but it essentially just allows doctors or surgeons and proceduralists to perform whatever procedures they need to while eliminating that aspect of pain or anxiety. And it creates that optimal operating environment so surgeons can perform what they need to while doing it in the most safe way possible.
Patients don't usually choose their anesthesiologist, but they meet them briefly before a procedure. What sorts of things do you want a patient to be aware of or to ask the anesthesiologist before the procedure?
Patients should be aware of their medical history, any medications they're currently taking, any medications that they took the morning of their procedure, their allergies, any prior experiences with anesthesia, if they've never had anesthesia before, any problems in their immediate family with anesthesia. And then they should also just follow any of the rules or directions they were given, either in their pre-admission testing appointment or by telephone prior to their procedure. So definitely follow those testing guidelines. And then also let us know of any advanced directives, like if they have a do not resuscitate or do not intubate order on file. I think you asked what questions they might have also. So any questions that the anesthesiologist hasn't gone over or anything that's on their mind, really, they should ask.
There are different types of anesthesia. General anesthesia is the one people probably think of the most when they think of anesthesia. Can you explain what that is and what it's used for, what types of operations it may be used for?
General anesthesia is used to make patients completely unconscious and pain-free during major surgeries like heart surgery or brain surgery or abdominal surgery, any orthopedic procedures, essentially any procedure that would be too painful or distressing to tolerate while awake. And also surgeons might necessitate an asleep patient because it can be easier to operate when the target's not moving.
How many different types of medication are used for general anesthesia?
So there's a number of medications that we use. One to essentially make the patient unconscious, and there's several medications that kind of fall in that category, including things that patients might already be familiar with, like propofol or some of our inhaled gases that keep patients asleep during the procedure. The other class of medications we typically use are opioids or narcotic to reduce pain both during the procedure and after the procedure. There's medications to reduce anxiety before the procedure that we use. And then other medications to control your heart rate and your blood pressure and nausea, we might administer during the procedure as well.
How long is it safe to keep someone under general anesthesia?
So most patients can safely receive general anesthesia from any number of minutes to several hours. Again, it's patient dependent, depending on their current chronic condition. But for the regular patient just off the street coming in for an elective procedure, they can undergo anesthesia for several hours without any complication.
Are there some patients that are not candidates for general anesthesia?
Anytime a patient refuses general anesthesia, that would be considered not a candidate because they are refusing it. But patients that have significant heart or lung issues may need more monitoring during the procedure. It doesn't necessarily rule them out from general anesthesia. Certain patients may need to be optimized either in their outpatient clinic settings or in the hospital prior to receiving general anesthesia, just so we create the most safe environment for them to undergo it.
So when someone's under general anesthesia, it's like they're asleep, I guess, but are they able to dream while they're under anesthesia?
No, they're asleep, but not in the way that you would be asleep just when you fall asleep at home. So they don't dream. Typically, you're not aware of your surroundings. You don't hear anything and you don't recall anything during the procedure.
Well, let's talk about regional anesthesia. What is that and when would it be used?
So regional anesthesia, basically we just inject some numbing medication around a bundle of nerves that numb up whatever target we are attempting to numb. So like an arm or a leg. Most people might be familiar with epidural for childbirth. So it can be used in a number of procedures. So any orthopedic procedure, like on your ankle or knee. There's even some regional techniques that we use for belly surgery. It can be used in a number of ways.
But the person's not asleep. They're awake for a regional?
They can be awake. There's a number of ways to use regional anesthesia. So you can either just numb up the extremity if the surgery warrants it and the patient can be awake for it. That's one option to do it. It can be used in conjunction with a general anesthetic. So the patient can be asleep and also receive a regional technique to reduce the amount of pain they feel both during and after the procedure. It can be used just as an adjunct after a general anesthetic. So when they're in the recovery phase, they can receive a nerve block to help decrease any sort of pain they might be experiencing.
How does that differ with local anesthesia? What is that used for in comparison with regional?
So it is very similar medications used in both. They're both local anesthetics, typically, that we're using for regional and for local anesthesia, whereas regional anesthesia typically targets a larger nerve bundle. Local anesthesia numbs up a very small specific area. So what people might be familiar with is like for dental work or for skin biopsies or stitches. The medication is applied directly to the area that they are working on, essentially. And there's no amount of sedation or anything given, so the patients are awake the entire time.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with anesthesiologist Susan Samudre, who is the director of regional anesthesia at Upstate. How different is anesthesia for children compared with adults?
Pretty different. They're not like just small adults. Essentially, there's anatomic and physiologic differences, like the way they metabolize medication. Children typically have slightly different anatomy that can make it a little bit different. And all of those things are taken into consideration when we do anesthesia for children.
Are you using the same medications for kids?
Yep, most of the medications are very similar. It's just differences in dosages. So they might require increased dosages for certain medications, and they might require decreased dosages for others. And that can be different depending on their age and their body weight as well.
Are there different complications to be on the lookout for with children?
Yeah. With adults, you're typically looking at more chronic conditions that they're bringing into surgery with them. With children, they don't necessarily always have those chronic conditions. They would be at higher risk for respiratory complications, and that's typically what we're dealing with versus like heart problems intraoperatively in the otherwise healthy child.
What can you tell us about cardiac anesthesia? I know it's general anesthesia. You mentioned that as one of the times that general anesthesia is used, but is this for any surgery involving the heart?
Yeah, cardiac anesthesia is for almost all surgeries that involve the heart. That includes open heart surgery, any surgery where there's some sort of repair on the valve within the heart itself. So that's where cardiac anesthesia would be used essentially.
Does the potential use of a cardiopulmonary bypass machine affect anesthesia choices?
It does. When they use the cardiopulmonary bypass machine, the heart stops and the lungs also stop. And so some of the anesthetics are given just prior to that. And then the perfusionist who's operating the cardiopulmonary bypass machine is also able to administer some anesthetic drugs to keep you asleep during that part of the procedure.
What about if there needs to be a blood transfusion? Does that have an impact on anesthesia?
It does not have an impact on the anesthetic itself, but the anesthesiologist is continuously monitoring a patient's heart rate and blood pressure and overall perfusion. So if they think a transfusion is indicated, they will give it to you based on your lab work and what's going on with your hemodynamics, your heart rate and blood pressure. They'll administer that just kind of as needed.
What about neuroanesthesiology for people with brain or spinal cord injuries? Is that similar to cardiac anesthesiology?
It's similar in the way that general anesthesia is typically used, but yeah, that would be more specific towards surgeries involving the brain and spinal cord, like you said.
I feel like we should go over the risks of anesthesia. I'm sure anesthesiologists go over these with their patients, but can you tell us what are the risks of having anesthesia?
So the risks include, and we typically go over this with our informed consent, nausea, vomiting, grogginess after the procedure, differences in your heart rate and your blood pressure and things like that. And the anesthesiologist's job is to kind of mitigate any of those issues and try to prevent them when possible. But certainly those risks are always there. And then anytime the patient has significant heart or lung problems, there can be additional risk with that. In addition to how big the surgery might be, there might be additional risks associated with each particular surgery.
And so, if someone has had previous surgeries and they had trouble with anesthesia, they had the nausea and vomiting afterward, and it was rough for them, that's something they need to let the anesthesiologist know before they have the next surgery, right?
Yeah, absolutely. There's a number of medications that we can give both during and after the surgery that can help decrease or eliminate that. And so if we know that you had post-op nausea, vomiting in prior surgeries, we might ask you what helped in the past, and we might do that again, or we might take additional precautions to try to avoid that as best we can.
Well, that's good to know. Dr. Samudre, I appreciate you making time for this interview.
Thank you for having me.
My guest has been Dr. Susan Samudre, an assistant professor of anesthesiology and director of regional anesthesia at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.